Welcome back to the Dr. Jeffrey Tauth Heart Talk Show, and today's show is called Dr. Jeffrey Tauth Heartburn versus Heart Attack Signs. And trust me, it's juicier than your cousin's peach cobbler. Now listen up, because what I'm about to tell you could literally save your life. Are you one of those folks dismissing dangerous chest pain as simple heartburn? Well, buckle up, Buttercup, because we're about to reveal the critical differences that could mean the difference between grabbing an antacid or grabbing your car keys for a trip to the emergency room. Let me paint you a picture here. I've had patients come into my office who've been popping Tums like candy for days, thinking they just ate too much barbecue when what they really had was their heart screaming for help. Yep, entirely true. I can't make this stuff up. So let's start with the big kahuna. Where does it hurt, and what does it feel like? Heart pain is like having an angry elephant decide to take a nap right on your chest. We're talking crushing pressure right in the center of your chest that radiates out to your jaw, your left arm, sometimes even your back. It's not subtle, folks. It's your heart's way of sending up a flare gun saying, "Houston, we have a problem." Now, heartburn, on the other hand, is that burning sensation right behind your breastbone. Think of it like acid doing the backstroke up your esophagus. It stays put, doesn't go wandering around your body like heart pain does. If your chest pain feels like someone lit a campfire in your throat, that's probably heartburn. If it feels like someone parked a Buick on your rib cage, maybe I should see you in the clinic. We need to talk. Next up, let's talk timing. Heart pain doesn't read your schedule, and it doesn't care if you're busy. It can show up when you're climbing stairs, when you're stressed about your mother-in-law visiting, or even when you're just chilling on the couch watching Netflix. The kicker? It hangs around like that relative who overstays their welcome. We're talking more than 5 to 10 minutes, and it doesn't get better when you change positions. Heartburn, bless its predictable little heart, usually shows up right after you've enjoyed that double cheeseburger or decided to lie down after dinner. It's got manners, it responds to antacids, and feels better when you sit up straight. Heart pain? It couldn't care less about your Pepto-Bismol. Now, here's where things get really serious, and I need you to listen carefully because this is life or death information. Heart attacks come with a whole parade of symptoms that heartburn just doesn't bring to the party. We're talking shortness of breath, nausea, cold sweats that make you feel like you just ran a marathon in Alaska. Some folks get dizzy, others feel like they could sleep for a week. And ladies, diabetics, listen up. Your symptoms might be sneakier than a cat burglar. You might just feel tired or have some jaw pain. As I always tell my patients, when in doubt, get checked out immediately. Your pride isn't worth your life, people. Let me tell you about Sarah. She's 52, tough as nails, and spent 3 whole days convinced that crushing feeling in her chest was just heartburn from her famous chili recipe. 3 days. When that pain finally decided to take a little vacation to her shoulder, she figured maybe she should get it checked out. Good thing she did, because Sarah was having a heart attack with a 90% blocked artery. 90%. That artery was more clogged than Atlanta traffic on a Friday afternoon. Quick intervention saved her life and prevented permanent heart damage. Sarah's doing great now, but man, that was close. Here's your takeaway, and I want you to tattoo this on your brain. Never, ever ignore chest pain that lasts more than 5 minutes. If you've got crushing chest pressure with sweating or nausea, you don't drive yourself anywhere. You call 911 immediately. Your life is worth the false alarm, trust me. I'd rather see you embarrassed in my emergency room than have your family planning your funeral because you were too proud to get checked out. The bottom line is this: your heart doesn't lie, and neither do I. When it comes to chest pain, it's better to be the person who cried wolf than the person who didn't cry at all. This has been the Dr. Jeffrey Tauth Heart Talk Show. Until next time, stay healthy, and remember, if you're looking for answers, check out drjeffreytauth.us.com. Later, y'all.